Since the opening of the Shree Swaminarayan Mandir, Oldham, we've supported a number of charities in the northwest, ranging from cancer research to social and domestic abuse. This year, when we were picking our charity, we wanted to choose a charity that not only supported the people of Oldham, but also had helped the people of this mandir.
It's really hard to kind of describe how it is here at the hospice. Everybody is so very welcoming, very supportive. Two of my family members was here at the hospice. My nan was here in 2013 and she spent a couple of days at the hospice before she peacefully died. And then more recently my auntie was here as well for end of life care. So not only that I see from a nursing point of view, but I've been on the receiving end as well as a family, and having that support and from the nursing teams and the clinical teams was really, really important as well. I think for kind of like the grieving process as well was really important to us as a family, and both my family members had very peaceful deaths here.
I would say Kershaw is not just a hospice. It's like a community that opens arms for you, that supports you. They have different curricular activities going on at the moment. They have got, different sessions going on, which could be beneficial for our own community. So, when you approach the Kershaw, they're not just hospice, they're not just giving care to end of life. They're actually there for everybody who actually goes there and approaches them to say, this is the problem. Do you think it's actually a problem? And they talk to you, they actually sit you down, they talk to you.
The staff, they were really, really kind. If we had a question, if we had any doubts, if the medical care was like, if we had any questions about it, they'd answer all the questions, and if they couldn't, they'd find someone who could. Mum got everything she wanted. Food was accessible, she could eat what she wanted when she wanted. If she didn't like something, they would change it or adapt it to her needs, and she really liked that. If you needed it, I'd say Dr. Kershaw's. I recommend Dr. Kershaw's. Their service is amazing, and they'll help you through everything you need, including the family and the patients.
I think for me the most rewarding part is being able to help meet patients' needs. If we're able to make that as nice as it can be, as comfortable as it can be. Death and dying is not going to be easy for patients and for the relatives, but if we can kind of think about what it is that would make it better for them, and if we can help to support that, then that is incredibly rewarding. And I think, again, for patients that are coming to us for symptom control, to be able to alleviate some of that suffering that they may have been having, whether that be in terms of kind of pain, nausea and vomiting, whatever symptom it may be that they're struggling with, if they can have a period of support and be able to live their life as well as they can for as long as they can throughout that palliative journey, if we can achieve that, I think it's incredibly rewarding.
So one of the key things that I remember about the treatment that Rima was going through more than anything else was on a Sunday night. I remember for some reason on a Sunday night I got a phone call to say someone's here to see you, they want to buy something. So I've kind of looked at them thinking, who wants to buy something from the temple? So I've kind of come across, and there's two nurses from Dr. Kershaw's here. Ultimately they came up to me and said, look, we're the nurses for Rima. She's kind of now gone into the final stages, and we want to buy her a gift. And in the temple we don't really sell anything, so I was like, actually what they were kind of trying to say was, I want to give her something that she's going to appreciate and going to bring her a little bit of peace. So we have some prayer beads, and there's a picture. So when the temple opened, the main idol that's in the center, there's a nice clean picture. That there's not many people in Oldham who have actually got that picture. So we managed to find one of those. We got the prayer beads, and we've got these beads around the neck that you wear. Again, whenever we put it in front of the idol, we kind of sanctify it. So we managed to get the picture and everything else, and kind of gave it to the Dr. Kershaw staff. But that's one thing I'll always remember in terms of the Dr. Kershaw staff. And when we were looking at partnering up, that's the first thing that I remembered, was actually their nurses came into the temple wanted to buy something for a patient, which you would never ever think of in any other hospital or in any other kind of service. So that over and above attitude of the staff is something that I personally won't forget, even though I wasn't affected by it. But to attach to Rima's story, it was something that's unique more than anything else.
Volunteers here do all kinds of different things. Our regular volunteers, that's who we concentrate on. So they'll work in our shops. So we've got 4 retail outlets. There's about 150 volunteers that work various shifts throughout a week in all of those. There's our reception, our cafe, which I think you've been in today. All couldn't operate without our volunteers.
They did help me, help Sanjay a lot, but they helped me staying there, having breakfast in the morning for me. And everything they did is no words for it. I haven't got words for them to say. It's very, very, thank you very much for helping such a, when my son was at the last stage of cancer.
I think it's almost like one of the best kept secrets, you know, in the world. Kershaw's, Spring Hill Hospice, a lot of hospices. We're talking about Kershaw's in particular here, but I mean, in the last 5 years, I've only been there twice out of our whole community for Sanjay and for Rima. Yet I know so many more people who have gone through that end of care. And I don't think they know the awareness isn't quite there. So I think we have a duty as an organisation to make our community aware of it. And what you guys have chosen to do through the temple this year and actually making Kershaw's your chosen charity for the next couple of years, I think that's a wonderful idea in terms of bridging that gap of knowledge. I think it'll do a tremendous amount of work. I'm sure you guys will be promoting it internally, and then obviously Kershaw's will be doing it.
We're not just about cancer, and we're not just about end of life. Patients that come here have a huge variety of different illnesses, which obviously are end of life, but it's not just about cancer. And also, it's not just about end of life. We have the wellbeing centre from point of diagnosis all the way through to if people do end up end of life to use our service. But we're out in the community, we have groups to cater for the majority of people, targeting people as well, like we have the men's group, we have the carers group. So it's not just about end of life, and it's a fantastic place. People think it's not a nice place, which it isn't, because obviously it's associated with grief between families. But it's a fantastic place, and I'd encourage people to come and have a look.
Whilst choosing the charity, not only did we want to raise funds for the charity, but we also wanted to remove the taboo aspect of the charity. The South Asian community has this belief that they can deal with any problems within their own household, and they don't like to go and ask for help. This charity is based in Oldham, and a number of our congregation have also utilised the services that they offer. As the Mandir moved towards its 50th anniversary, we wanted to select a charity that we could support over the next 2 years. This collaboration will involve a number of events and fundraising activities to help not just with money, but also to help raise awareness and remove the taboo aspect of asking for help within the South Asian community.